Kaplan Meir curve. It is a survivalship curve. A group of patients are monitored over time to calculate survivalship. The benefit is that it doesn't actually take into account when they are entered into the study. All are analyzed and added. For example, one patient may be added this month and the next patient after 1 year. In short, we start from the 100% and then we have a dip or a drop. The bigger the drop, the larger the loss. In cancer patients, we have patient therapy results. In orthopedic, we use the survivalship curve for the implants in NJR. And from day 0 we start and we check the revision or failure. The horizontal line is a time and the vertical line is the probability. So when we start from the left side and go towards right side, then there is a drop line, and this is called censoring. Censoring can be of multiple types. They can be right censoring, means that the person has left the follow-up and could not complete the study. Or they can be left censoring, where the event has occurred and we don't know when the event has occurred. Or the event has occurred before the data has been collected. The benefit is it interprets data and helps us to identify our outcome results. The disadvantage is that the death or implant failure is taken as the outcome. Number second important thing is that if the quantity is low, the drop is large. So if, for example, we start with 100% patients and it became 88 or it became 50 and another patient drops out, it is not 1%, actually it is 2%. Number 3, it is nowadays quality of life is more important, which is not tested. It tests only failure by revisions. So not best for outcomes.